Hello, my name is Haley Brown. I am in Adult Health 1, Term 2 in Professor Lloyd's class, and today I'm going to be demonstrating hanging a primary line via a mini bag. So before we start the procedure, we're going to make sure that we verify the MD's orders against my MAR to make sure that I have the correct patient and the correct procedure that needs to be done, as well as the doctor's order for the drugs that need to be implemented. In this case, it's going to be 100 mLs of normal saline, 0.9%, which I have gone ahead and documented on my bag, which also includes the drug that I'm going to be giving, the dose, the date, time, my initials, and the patient's name. So we know what the order is again, and I've gone ahead and calculated that measurement. Some of the tools that we're going to need are gloves, the primary lining, which would be in this bag here, and you grab this from the med room, and note that the drop factor is going to be 10. That's going to be important later. We're going to need a normal saline flush and some alcohol gauze. So before we leave this med room, we're going to make sure that we prime and date everything. Like I said, I already have put that on the back of my mini bag, and as well as put the date and time and initials onto the line so we know when that goes bad. So what we're going to go ahead and do is prime that line. So what I'm going to do is make sure that this is all untangled out of my bag, making sure that the cap stays on my line because I want to keep that clean. I'm going to go ahead and open this up, and we're going to pull the little blue cap off the IV bag, being careful whenever we insert this. And we're going to open up this line, like I said. We're going to go ahead and squeeze it to get some of the air, some water into the chamber, which I have. We're going to go ahead and make sure that water primes to the tube and that there's no air bubbles. And I'm not noticing any, and we're having our water come out of our line here. So I'm going to go ahead and clamp this, and it is primed. I'm going to put this back on my table. We're going to go ahead and bring all this equipment into our patient's room because we want to make sure that everything is clean and working before we go in there. So I'm going to go into the patient's room. Hello, my name is Haley. I'm going to be your student nurse today, and today I'm going to be performing. Your doctor has ordered an IV drip of normal saline of 100 mLs. Could you please tell me your name and date of birth? Okay. And Mr. Jones, do you have? I'm going to verify that against my MAR and your wristband, and everything is correct as well as my orders. Do you have any allergies, Mr. Jones? Okay, very good. So I'm going to go ahead and wash my hands, and I've explained to you the procedure that I'm going to be hanging this line. So I'm going to go ahead and actually hang this to get it out of the way. I'm just going to hang this line here out the way so it's not laying on the floor. Okay, so I'm going to go ahead and wash my hands, and I'm just going to take a look at your IV site, Mr. Jones, and I am looking for any redness, any swelling, making sure that nothing is wrong with the IV site before I go ahead and hook it up. And it looks like there's no tenderness, no swelling, anything. It looks pretty good. So what I'm going to do next is go ahead and put on my gloves. And I'm going to go ahead, bring my stuff over here before. I got my alcohol preps. I'm going to clean the INT port because I don't want to make sure that it's super clean. You just take this alcohol rub and scrub it nice and good. Then we can throw that away. And then again, I have my normal saline that I already prepped here. What I'm going to be doing is using, this is just making sure that my line is still open and patent and still working well. So I'm going to go ahead and unclamp that INT that was clamped from earlier. I'm going to aspirate back and I get a blood flash, so I know that I'm in the right spot. And I'm going to go ahead and use the push stop method. So I'm going to push a little bit, push a little bit more. Okay, and it is going in. I have implemented 3 mLs, and as I'm giving some positive pressure, we're going to go ahead and clamp the INT back. Now we can remove the rest of my normal saline. I don't need that anymore. Next, I'm going to go ahead and clean that port once again, because I'm about to get ready to hook it up to my IV line. Okay, so all clean. Now I'm going to grab that line from before. And remember that protective cover that I said was on here. Go ahead and take that off. So the cap's going to come off. We're going to insert that in to my now clean INT. Okay, so now that we're all attached, I'm going to go ahead and open this line. Get it running. I'm going to make sure that this is unclamped here. So everything is infusing now. And as I said before, the calculations, we're going to make sure that we are running at 17 drops per minute. So you're just going to take this time, you have your watch, you're going to take a look at this drip chamber, and with the rolling part, you're going to measure out 17 drops per minute. Okay, once you've found that, you can go ahead and just hook it out of the way. In this case, you give slack for Mr. Jones so that he wouldn't be pulling or messing it around. And you're going to double check before you leave. Always make sure that this is still running properly, which I do see that it is. And then we're also going to check the IV site. Ask Mr. Jones, how is he doing? I want to make sure that there's no allergic reactions, most importantly. And I'm going to check and make sure that the IV site is still running smoothly, that I'm not seeing anything leaking, bubbling up, and everything seems to be working smoothly. And Mr. Jones is still comfortable. So that finishes the procedure as far as that goes. Moving on to the documentation, we're going to go ahead and record the time and date that this medication was hung, as well as I mentioned, labeling everything so that it can always be monitored from later on. It can be double checked. We're going to documentate the condition of the IV site. How I said that it was looking good, everything was flowing right. There was no signs of redness or irritation or tenderness or anything like that, and no no medications to the line I hung, as well as document that order that was asked. So that finishes up hanging up the primary minibag.